I'm Dr. Toni Youngdahl, a family practice physician at Grand Itasca Clinic and Hospital. Well, a sports physical really focuses on whether a patient is safe to participate in a specific sport. At a high school level, they're required for the Minnesota State High School League. If a child is healthy, they can go every 2 to 3 years, but in some situations we will have kids come back every year. I think kids in general, lots of kids have a fear of coming to the doctor. The physical exam is really basic and not embarrassing and not painful. We really just stick to a good heart and lung exam and joint exam, so that shouldn't be a reason to keep kids away. For a lot of teens, it is really our only opportunity to see them in the clinic for like a non-acute issue. After 7th grade, it seems like a lot of our patients sort of disappear and we don't see them again until they're due for their sports physical. So most of us take an opportunity to address other topics such as mental health, school performance, peer relationships. Obviously, we update vaccines. And then it also gives us opportunity to talk about concussions and screen for cardiac diseases prior to participation. We like to talk about nutrition and importance of just healthy lifestyle choices during those visits. Obviously, we still recommend annual well-child visits for all kids. The sports physical is really more about screening questions and making sure they're safe, so we do still recommend both of them. Honestly, I think my biggest recommendation would be for kids to not specialize in sports at an early age. That's really common now that kids, by the time they're in even junior high, have just started to focus on one sport. And the problem with that is that it's going to increase the risk of sports-related injuries and overuse injuries. So really encouraging kids to continue to participate in multiple activities, not just sports, but band and trap shooting and other activities that they can do, so that they're not so focused on just one thing. We do see a lot of overuse injuries in specific, sports, and it's hard once those injuries start to sort of get a handle on them. It's really important that athletes at all ages take the time to rest between practices and games, and really stress the importance of adequate sleep at night. That's our body's chance to recover and sort of refuel for the next day. Nutrition is really important and can be a really difficult thing for young athletes, staying well hydrated, and so it's important to talk about those issues at the sports physical. Well, we tend to have athletic trainers or physicians or other providers at a lot of the high school events. So obviously, in an acute injury during a game, we're able to sort of see those athletes at that time. But for other athletes, it would be, if you have persistent joint pain or swelling, feelings of instability, or if a joint is popping or making funny noises, obviously that would be a time to come in to the doctor to have that evaluated. Grand Itasca Clinic and Hospital, your partner in health.